So I came back off vacation in July 2019, and first shower I took, the water hit me and I had a little bit of pain. So I did a self breast exam, felt a lump, tried to ignore it, kind of attributed it to hormones and being around my menstrual cycle. So I decided to wait about a month to see if it kind of went away. It did not. So I made an appointment with my gynecologist, and then from there, it was just a snowball of appointments, biopsies, until diagnosis. So I was officially diagnosed on October 17th, 2019 with stage 2 breast cancer. The good thing is that it was detected early enough so that the prognosis was you have stage 2 breast cancer, but it's with curative intent. So after probably almost 10 biopsies over a 2-month span, I had a lumpectomy in December 2019. I had breast cancer did spread to about 3 lymph nodes. And so they did the lumpectomy, and then they did what they call sentinel node biopsy, where they removed the 3 lymph nodes. Pathology came back clear. They still wanted me to do chemo and radiation because it had traveled into my lymphatic channels. So February 2020 is when I started chemotherapy officially. Hair loss, changes in my body, all kinds of changes, like tiredness. I did opt to work the entire time, and then pandemic hit as well. So it was difficult because I couldn't have my family at treatment with me. That was probably the most difficult parts of it, and then losing my hair, of course. At the end of chemotherapy, I shaved off what little bit of hair I had left. And I made a personal decision because I had so much anxiety around recurrence. I decided that I wanted to go back and get a bilateral mastectomy. And then in September 2020 is when I started radiation. I successfully completed that in October of 2020. October 20th was my last active treatment. And then since then, it's just been a whirlwind. You know, I consider myself cancer-free. That's what I use as my cancerversary date, October 20th. But you know, the battle is not over. You go through so much more. And after my 3rd surgery, I developed the non-medical term of frozen shoulders. Which completely blew me away. I thought I had made it through 2 surgeries prior to that, no issues with mobility, with range of motion, and then this comes. I think it was gradual that I noticed changes in my range of motion. It was surprising to me, and for lack of a better term, it was almost catastrophic too, because I thought I had gotten over all the humps. And it started as stiffness, where sometimes I would try to lay on my side or lay with my arm up, and then it would be so painful afterwards, or I would have to, I can only do that for a short amount of time because it would be so painful. Then gradually I noticed like I couldn't lift my arms as high as I could. I struggled with putting on clothes. Even I couldn't put my hands on my hips anymore. Just everything, normal thing, reaching for things, it just, everything changed, and it was difficult. So it was devastating. Yeah, very hard to cope with at first because I felt like, oh my God, I didn't really understand what was happening. And my thought was like, I'm not gonna be able to fix this. It's gonna be like this forever. Like, I can't believe this is happening to me. So I actually was working out previously here at the Route 1 facility here in Elkridge. So I was coming here all throughout my cancer treatment, even before I had started working out here. And I was familiar with the team here. I was familiar with some of the therapists, and I knew some athletes that actually had services with FX. So for me, it just made sense. I felt like, anyway, like this, everyone here is a family. And so it just made sense for me to continue that part of my journey here as well. Like I said, I didn't think I would get back to normal. I usually over-research things and try to make myself really smart. I did not, but this, I don't know why. I was so tired. And so when I started physical therapy, I had no idea about anything. Was this something that I could recover from? How long would it take? What are some of the things, you know, that comes along with the physical therapy? So I had absolutely no clue what I was walking into. Just the simple things that I could not even I couldn't reach behind my back at all, or I couldn't, without assistance, put a shirt on over my head. Even something as simple as if something would brush against my shoulder and push it back, I would drop to the floor in pain before, because that's how bad it was. So those things are not as prevalent anymore. My range of motion has increased, still have long way to go, but the pains that I have from doing simple things don't exist anymore. I'm able to do things more easily. I'll say I attribute it to the staff here. I mean, I feel like the touch too, right, that the staff has and the care given to me, and they're just so thorough. I mean, I worked with 3 therapists altogether, because that's how much they care. They want to make sure that they're giving me the best treatment that I can get. So all of those things, I'll say that even the dry needling with the stem, I think has tremendously helped me. So I have a surgery coming up in the next month that we talked about maybe trying after my next surgery to see if it's needed. We're hoping that surgery might help the condition a little bit as well. So still remains to be seen. It's important to trust your team. There's a lot of doctors and a lot of nurses and medical professionals, but I think finding a team that you trust is important. I think educating yourself, you don't have to be the smartest person in the room. I think it's important to be the loudest when it comes to yourself. Self-advocacy, I think, is super important. I think that for me, I think I left this out when I decided to get my bilateral mastectomy. All my pathology was clear, my PET scans were clear, I had a mammogram that was clear, and the pathology after my bilateral mastectomy that I chose to do showed a 3mm spot of cancer that nothing else picked up, that would have still been growing in me if I wouldn't have advocated for myself to move forward. So I think that's super important, and I think having a support system even for survivorship. The battle doesn't end when you finish treatment and they tell you that there's no evidence of disease and you're cancer free. Still mentally, physically, you're going through a lot still afterwards. And I think not going through it by yourself, finding people that understand what you're going through and that understand your journey, that are qualified to help you. I think having them as part of your support system is really important. I'll say even the FX staff here, Lindsay, she advocates for me. I was having trouble getting surgery scheduled with my plastic surgery, for this next surgery, and she was like, give me the number, I'll call. So I think just finding people that you trust and care about you is important. That's how much they care. They want to make sure that they're giving me the best treatment that I can get. So all of those things, I'll say that even the dry needling with the stem, I think has tremendously helped me. So there's some things that I have a surgery coming up in the next month that we talked about maybe trying after my next surgery to see if it's needed. We're hoping that surgery might help the condition a little bit as well. So still remains to be seen. No genetics, no BRCA gene. It's crazy that way. There's so many different diagnoses, so many treatment plans, and they still can't tell you exactly why.